We are kicking off the Medicare annual election period. Here to tell us more is Agency Principal Miriam Ramos with Mint Insurance Agency. Welcome to the show, Miriam.
Thank you so much. It's my pleasure to be here this morning.
Glad you're here. We've got a lot to go over.
Tons.
This is a very complicated matter as far as I'm concerned. So tell us, what exactly does annual election period mean?
So it can be known as annual election period or annual enrollment period.
Okay.
So it is that time of the year where Medicare eligibles get to shop, and they get to shop for their health plan, right? They want to ensure that the plan they're currently on is going to continue to cover their prescriptions for next year, or ensure that the health plan will continue to contract with their current providers. This is the time where they can come out, ask questions, see if there's a plan that fits their needs best, or if not, stay on the plan they're on.
Mm-hmm. So what exactly is Medicare?
Medicare is a federal benefit. So for those that do have Medicare, they might recognize it's a paper card with the red, white, and blue, right? It only covers 80% of their hospital needs and 80% of their medical needs if they stay on original Medicare. However, if they choose to go onto a Medicare Advantage plan, which is known as Part C, it includes Part D, which helps with the coverage of their prescription drug plans. Technically, it bundles, right? And these individuals are the ones that we encourage to call, come out, or meet with so we can review their current Medicare Advantage plan, see if it's still a good fit for them, or if we can help them with a change for next year.
Okay, that brings a lot of clarity to that. So who qualifies for Medicare?
Individuals who are 65 and over.
Okay.
So if anybody is about to turn 65, you want to make sure you reach out, give us a call. You have a 7-month enrollment window to avoid any late enrollment penalties. Also, individuals that have been disabled 100% by the state of California, since our viewers are here in California, for more than 2 years. Last but not least, anybody that has end-stage renal disease, no matter what age they are, they will be awarded Medicare. So any of these individuals may be eligible for Medicare, which is, once again, a federal benefit.
Okay. So what kind of challenges do you foresee for 2025, if any?
You know, more so than a challenge, it's all of the changes that are coming, right? We do see, we've heard a lot about Inflation Reduction Act and what does that mean for my prescriptions and for my benefits. Well, this is why we encourage you to talk to a licensed agent like Mint's agents or your current agent if you have one, and talk about what are those changes, right, when it comes to prescription drugs, because there will be. For 2025, we're looking into new terminology, things that we haven't seen in over 20 years, things like deductibles, payment plans, different things that your viewers are just not used to. So this is the perfect time to just come out and shop, really learn about those changes in detail and see if they will be impacting you or your loved one.
And why do you think that there are so many changes?
Well, at the end of the day, we can get really into detail, right? But we don't want to confuse anyone because everybody has such different needs, and that's what we do. When we meet with you, we are there to identify your specific needs, review your prescriptions, your network of doctors, and such. Those changes that are coming may really benefit some of the beneficiaries. Why? Because there will no longer be a donut hole or a coverage gap. And see, now we're getting into terms that some people may recognize and some people may think, what does that mean? And that's why it's just so important to connect with us so we can make it easy and simple, give you that zen, and allow us to help you check off that box, not worry about it, enjoy the holidays. So yes, changes are coming. Let's just focus on your specific needs And these changes may or may not impact you. Once again, they revolve heavily around the prescription drug coverage. And then, of course, then there's the fun and exciting new benefits for next year that everybody does want to know, right? So there's both. There's both. And it's interesting, and it's time to talk about them.
It is. And talk to me about why is there a specific time of the year now when there is an open enrollment? Why can't enrollment just be year-round?
Well, that's a question for CMS. That's the Center of Medicare and Medicaid Services, right? So they are the ones that determine when the enrollment periods will come about. We are currently in the annual election or the annual enrollment period. It runs from October 15th, so it just started. It ends December 7th. This is the time of the year, like I said, that anybody that's currently on a Medicare Advantage plan gets to shop around, make changes that will become effective January 1st. Then, to not confuse anyone, but it may be, from January 1st through March 31st, we have the open enrollment period. What does that mean? It means that if you made a change during the October 15th through December 7th period, you go on to use your new benefits next year, and you realize you really didn't find a fit, you can call us back and we can help you find another Medicare Advantage plan or go back to the one you had.
All right.
So those are two different election periods, and there are more. There's something called the special election period of chronic conditions. What does that mean, Miriam? It's such a mouthful. Well, that if any of your viewers have a chronic condition like diabetes, chronic heart failure, COPD, asthma, sometimes dementia, right, and such, these individuals may qualify to make a change during every month of the year if there is the plan available in their area designed specifically for their needs.
Well, that's good to know.
Absolutely. So there's so many hoops and loops, and that's why we are the experts.
Can't possibly navigate them without somebody with your expertise and service availability.
Thank you.
Are there scams that surround the Medicare industry?
Unfortunately, yes. And one of the first ones, and what we always encourage your viewers to pay attention to, if you are receiving unsolicited calls, that's your number one flag. Okay, this is why we're here today. This is why we provide you with our information, so you initiate that call. If you do not initiate the call, how do you know who's on the other side of the phone?
Right.
What their intent is, or what kind of information they're trying to gather from you.
Right.
So that's the number one thing. If it's a licensed insurance agent that's calling you, number one, that's a big no-no. So you're welcome to ask, well, can I have your license number? And they probably won't give it to you because they know you can call Medicare and report them for being non-compliant.
Well, and to that point, though, they probably will be ready to rattle off any X number just to suffice the person who answers the phone. So I think it's just better, because we had this conversation with our CEO yesterday, of bank scams. So just don't even answer the phone.
No.
But you're making the consultation and enrollment process very easy.
We are.
Clients have multiple ways to get in touch with you. Let's tell our viewers the many opportunities they have to connect with you.
Certainly. So we are so happy to be able to connect with you directly, whether it's a telephonic appointment, so we can just get a consultation going, right? Check your doctors, your zip code, your prescriptions. We can schedule an appointment in the comfort of your home. We can meet with you at one of the centers here, or even a coffee shop. Share a cup of coffee, share a cup of tea, mint preferably.
My favorite.
Yes.
And it's zero cost
to
consult with you.
100%.
Right?
And the enrollment is zero cost as well.
Wonderful.
And most of these Medicare Advantage plans have a 0 monthly premium as well.
Oh my goodness.
So I mean, opportunities, benefits are endless.
Yes.
It's just a matter of connecting.
Yes. And then quickly, can you clarify any penalties for those who aren't able to get in the allotted time?
So quite frankly, if your viewers decide not to make any changes, they won't be penalized, but they may be surprised with changes come the new year. And once again, they're out of the annual enrollment period. So unless they have a chronic condition, it may be a little challenging for them to make a change come January 1st. You may be referring to the late enrollment penalty. That refers to those individuals, like I mentioned earlier, that turn 65 and have a 7-month window, right? So once again, just give us a call, connect with us, and allow us to guide you through it. Make it easy, make it zen.
Okay, well, on that note, Miriam, thank you so much for that valuable information.
Truly my pleasure.
I know our viewers are going to really appreciate it, and all of you need to contact Miriam. You are watching This Day on Village Television. We'll be right back.